Hi everybody, Dr. A again. In this third video on the introduction to the clinical lab, we are going to look at definitions and concepts that are used in the clinical laboratory. Alright, so laboratory testing is used for several reasons. It is used to detect disease, to guide treatment, and to monitor treatment or disease. So to detect disease, for example, you can use it to detect if a patient has diabetes by running a fasting glucose or even a random glucose and a hemoglobin A1C, and I can tell you if your patient has diabetes or doesn't have diabetes. To guide treatment, an example would be if a patient has a specific infection, we can do antibiotic sensitivities, and then that can help direct the antibiotic antimicrobial treatment selection that would be most optimal for that patient. And then to monitor treatment or disease, then yes, we can, for example, do some follow-up cultures or some follow-up testing to make sure that an infection is resolving. We can monitor a chronic disease such as diabetes by doing hemoglobin A1Cs quarterly, semi-annually, or even annually. And so these are big roles in the lab and really the mainstay of what we do in the lab. All right, so invasive versus non-invasive tests. So non-invasive tests are procedures that will examine fluids or other substances without using a needle, tube, device, or scope to penetrate the skin or enter the body, therefore non-invasive. So any test on urine or feces are completely non-invasive because they're very easy to obtain. Invasive tests are procedures that examine fluids or tissues that are obtained by using a needle, tube, device, or scope to penetrate the skin or enter the body. Most of your blood samples are obviously in that categories because you have to obtain them via venipuncture, which is venous blood draw, therefore sticking a needle in somebody's arm to pull the blood out. Some definitions. So a specimen is a sample that is used for laboratory analysis. It can be blood, sweat, feces, sputum, really any body fluids. Plasma is the watery acellular portion of the blood. So it is usually obtained if the specimen tube has anticoagulant in it, and then it has also been spun down, centrifuge to where all the cells are at the bottom and the plasma is at the top, and then you can run tests on plasma. And then of course to that, then of course a whole blood sample would be testing on the whole blood without spinning it down and without isolating the plasma from it. Serum, in contrast to plasma, is the liquid that remains after the blood tube has clotted or coagulated. So serum tubes do not have any anticoagulants in them. And so the blood is allowed to naturally clot. That clot needs to be fully formed. And then once a fully formed clot has occurred, that sample can be spun down, and what is left is serum. And lab tests can be run on plasma, on serum, or on whole blood. Some tests will have specific requirements. One of the advantages of plasma and why the lab uses a lot of plasma for a lot of the chemistry tests is because it's anticoagulated, you can centrifuge it right away and you do not have to wait for the clotting process to happen. And so sometimes they're a little faster to get to, faster to process. But obviously you want to test the proper specimen for the type of test that you need. An analyte is the substance that's measured by the assay. An example of an analyte would be glucose or potassium or sodium or an enzyme like AST. That is the analyte. That is what we are measuring in that specific test. Quantitative versus qualitative test. So a quantitative test is a test whose results are reported as an exact numeric measurement, an exact number. It has a quantity, it has a value. And that quantity or value is then assessed in the context of a reference range. And so it's in reference range or it's out of the reference range, meaning the reference range would represent what would be normal in the population. A blood glucose value of 85 milligrams per deciliter would be a quantitative test, and it would be assessed in the reference range, which could be 80 to 100, meaning that would be normal. If that glucose test had been 150 milligrams per DL, then it would have been outside of the reference range and considered abnormal. A qualitative test is a test whose results are reported as either negative or positive without further characterization of how positive or how negative that test is. So it's either there or it's not. If you take the example of the pregnancy test, the qualitative test result in a pregnancy test is it's positive or negative. And the quantitative test results is that it has a specific value, 165 milli-IU per mil, and the reference range would be 50 to 500, so it's within range for being 2 to 4 weeks pregnant. So there you go. That gives you, this is one of the ones that has a positive, negative, so it has a qualitative and also a quantitative. There are some tests in the lab that are only qualitative, so like the flu test and the strep test. It's either there or it's not. It's either positive or it's negative. And then there are a lot that are quantitative, where we have a specific white count and a CBC, a specific hemoglobin value. Those would all be quantitative. Some more definitions. So sensitivity and specificity. So sensitivity refers to the ability of a test to identify positive results in patients who have the disease. The higher the sensitivity, the lower the chance of a false negative results. Also, really high sensitive tests are able to detect lower amounts of a substance to detect a disease. So we want tests that are very sensitive. So we want to be able to, when we screen or do a diagnostic test on somebody, identify those that actually have the disease. The specificity refers to the percent of negative results in people without the disease. So its ability to rule out things and to not cross-react with other things. So the lower the specificity, the higher the chance of a false positive result. So again, you want tests that are highly specific and highly sensitive. Okay, you want them to detect the disease and you don't want them to be detecting other things. So if they don't have the disease, you want that result to be negative. A reference range is a statistically derived numerical range that has been obtained by testing a sample of individuals that are assumed to be healthy. So it's usually healthy adults. It is usually established as the mean of all of those samples, or the average, plus or minus 2 standard deviations, which gives it a 95% confidence interval around that mean, meaning 95% of healthy individuals should fall within this reference range. And then we use that to interpret those numerical results, and results that would fall either below or above this reference range then would be deemed to be abnormal and could be indicative of diseases. Point of care testing, also known as POC or POCT, it refers to clinician directed diagnostic testing that is performed at or near the site of patient care rather than in a centralized laboratory. So it's bedside testing. Some of those alternative sites of testing that are outside of the main lab can be emergency rooms, operating rooms, recovery rooms, patient rooms, and critical care units. And examples of point of care testing can include a fingerstick glucose monitor, the urine dipsticks, the activated clotting time test, and fingerstick hemoglobins. You could even throw the ABGs in there in critical care, because often the ABG analyzer is really close by that patient or that critical care unit. So those are all examples. And these are all tests that are easy to perform, and that the value of doing them at the bedside is great because you have a very quick turnaround time. So quality assessment versus quality control. So quality assessment is also known as QA. It was mandated by CLIA 88, so that's a law, and is administered by the Center for Medicaid and Medicare Services to reduce and potentially eliminate lab errors in order to ensure high quality lab tests and good patient care. QA, if you will, it embraces all aspects of testing. So it starts from having the right test ordered on the right patient at the right time, to having it collected appropriately in the right tube at the right time on the right patient, to it being properly processed and then run on the different analyzers depending on the test, and then those results have been properly entered into the electronic chart records and have been documented by the clinician, so by the doctor or nurses, and they have, evaluated those and then, appropriately treated the patient. So it's the whole process, and there's a lot of things that can go wrong in that process. So QA is involved in keeping high quality in the process from start to finish. Quality control is more specific. So quality control is also known as QC, and that is a process that monitors the performance of lab instruments, reagents, and lab personnel, in addition to confirming the accuracy and reproducibility of the results through the use of control specimens. So quality control is specific to an instrument or specific to a test kit. And it is part of the QA process, but it is a small part of the QA process. So what we do in a lot of these analyzers is those control specimens, if you will, are like fake patient specimens on whom we already know what the results are supposed to be. And so we run them through the machine and see if we get the results that we expect to get. If the machine and the reagents and the personnel is all operating the testing in the machine properly, everything's going well, instruments doing well, the reagents aren't expired, the reagents are good, the personnel running the machine knows what they're doing, then we should get the expected results from the control specimens, and then that checks that the lab results we are turning out are accurate and reproducible. So what is the rationale for ordering lab tests? So lab tests are performed with the expectation that the results obtained will either discover occult disease, so occult meaning hidden away, like there's something that's wrong but we're not sure and we're going to run some tests to see if we can find out what's going on. Or to confirm a suspected diagnosis, so the doctor's like, well, it looks like you might have the flu, it looks like you might have strep or this and that, let's just run this test and confirm that. It can differentiate among possible diagnoses, and so again we could look at somebody that has pneumonia and maybe with several tests decide if this is bacterial or viral pneumonia, so that can help guide the treatment. It can determine the stage or activity of disease. That would be especially relevant for cancer staging, and can detect disease reoccurrence. So that would be also pretty relevant in cancer. So if something has been in remission, we can use certain lab tests to monitor that it stays in remission and pick up if it shows back up. And it can assess the effectiveness of therapy. So this could be for chronic diseases such as diabetes. We can see if their medication is working, if their lifestyle change is working, if their sugar is under control by the use of the A1C test. That would be one example. And it can guide the course of therapy. Again, the antibiotic selection with antibiotic sensitivity in cultures on infections is a good one for the guiding the course of therapy example. So lab tests are categorized as either screening tests or diagnostic tests. So screening tests are generally performed in individuals without signs or symptoms of a disease, and they are helpful in detecting the disease early when interventions are likely to be effective. An example would be screening men over 50 with the prostate-specific antigen, the PSA test, to detect maybe early occurrences of prostate cancer. And then the pap smear in ladies to detect early changes that might be cervical cancer. The lipid panel that could detect changes in the lipid values that could be indicative of heart disease. And the diagnostic tests are really the bulk of the tests that are done in the lab. So they are performed in individuals that have signs or symptoms of disease and have a history that suggests the possibility of a specific disease or disorder, or they have an abnormal screening test, and we're further investigating that. Diagnostic tests are used to confirm a suspected diagnosis, to differentiate among possible diagnoses, to determine the stage or activity of the disease, to detect disease recurrence, and to assess and guide a therapeutic course. Literally, the bulk of what we do in the lab are going to be diagnostic tests. So lastly, we're going to look at factors that can affect laboratory test results. So the specimen. So this is really wide on the specimen. Was this right specimen collected? Is it collected in a proper container from the right patient at the right time? Is it properly labeled, etc.? Then proper anticoagulant. All those are specimen specific things. Time. So the timing of the specimen can be important. It can be important in relationship to medication that's given. It can be important to time of day, time in relationship to fasting, etc. So time of the specimen is important. There are also values that do change throughout the day, and that would be the difference between time and diurnal rhythms. Let's go ahead and address that one. Diurnal rhythms means that they are values of certain analytes that change depending on what time of day it is. A very quick and easy one is testosterone. So testosterone in men has to be higher in the morning and lower in the evening. Okay, so age, this is age of the patient. So the majority of the lab reference ranges are for healthy adults, and some of those values have different reference ranges for pediatric patients and for geriatric patients. These ranges can also change by gender. So there are certain lab values that you have different ranges for males and females. So for example, the hemoglobin is one of them. Males tend to have higher hemoglobin, normal hemoglobin values than females. There are other values that where ethnicity plays a role. So we see some variance by ethnicity within the certain ranges. So genetics can also affect lab results, meaning, when we do reference ranges, we're looking at what 95% of the healthy adults population, even in that area, would, expect to have those, values that are in the reference range. But you do have to acknowledge that we are each individuals, and that we are genetically different from one another, and there are some things where, for example, if you take blood glucose, a normal blood glucose for me might be 85, and for you that might be 80 or 90 or something like that. And so even if it's within the reference range, there can be some individual variety here, and that's due to our genetic differences. And that's not even accounting for genetic diseases and things that would obviously change certain lab tests. Then we've looked at diurnal rhythms. Drugs, if a patient is taking specific drugs that are prescribed to them, some of those drugs can interfere with certain tests, and it's important to note if the patient is taking drugs, and it can even be supplements, B vitamin, vitamin C, different things like that can interfere with some of the lab test results. Pregnancy does change reference ranges and values for certain things. For example, the alkaline phosphatase level in pregnant women are always going to be higher than in normal healthy adults. For organ function, as we age, some of the organ function may decline. So then that ties again into age. But an example would be, for example, somebody that has COPD, so chronic obstructive pulmonary disease, or emphysema. Their lung function has decreased, their organ function has decreased, and this patient, for example, could have a oxygen saturation of 90%. And that's normal for them, whereas a healthy person, theirs would be 98%. And so organ function can dictate a difference in the specimen and what would be expected from that specimen. Diet and fluids. So yeah, the diet that the person is on can affect certain lab results. And also meaning whether they have eaten or not eaten, whether it's fasting or post-meal, postprandial, and fluids, whether they are hydrated or dehydrated. Those can affect also the results. And sometimes that could be something you want to detect. You want to detect if they are dehydrated. But you do also have to know that if they are dehydrated, they haven't drunk enough that morning or whatever, then it could affect the results. And then posture and altitude. So if the specimen is collected while the patient is laying down versus standing, it can affect certain results. And then altitude, far above sea level, that can also change certain results because some of the pressures, changes of the gases, etc. So anyway, so that wraps it up into everything that can affect your specimen. It's a lot of things. And it's the end of that third video, and I appreciate your attention.